name is Chris Kasema. I'm the host of what we call the Afro-Global conversation. This time around, I wanted to do it differently. I wanted to bring different people from different places to share our experiences and our thoughts and see how possibly we can come up, we can predict, we can come up with the ideas that predict how the future look like. I'll start with you, and I want you to help us understand in terms of the tug of war between China and the US. How do you think the structure of the international system is going to be affected, especially by this coronavirus?
Looking at the international political economy system, I would say that the US for a while has been the hegemon in acting in anything economic at the system and influencing the politics and the voting system. But over time, it has been changing. It has been changing in a really slow way when we see how most developing countries who normally feel left out in economic deals and economic matters have been looking east and looking at China to help them influence their policies. What happens now is that we have a situation that seems to have accelerated a change where most developed countries had not seen that far ahead. So we have countries like Britain or the UK, which had just had the Brexit, right? And they had not foreseen something like this happening. We have the US, which has been going through an intense and a change of guard, if I may say, after their 2016 elections, and it has been withdrawing in some ways from the international politics and trying to shape its agenda based from the coming from the national and just focusing on the national instead of being the international prefect as it used to be. So I think what has happened, and I'll just use my knowledge in the program that I'm doing global governance and human security. And the purpose of this program is to say that the days that states were the only actors who could influence the international political system is quickly reducing, and that is really changing because we now see that many non-state actors have the capacity to actually influence what is discussed at the international level. So global governance means when states and non-state actors come together to try and understand and discuss and solve global issues. Because today we have issues that even if one state has an issue, it tends to cross borders and it tends to just not observe the physical barriers or the physical border. So it becomes a transboundary issue or an international issue. So global governance is when all these actors from wherever come together and try and solve this issue. The purpose of human security in this case is to say that when all these actors come together, their goal is to make a human-centered policy, meaning that whatever decisions they make at the global level should actually be human-centric. So you see an issue like this COVID-19 that we're looking at, it was an individual, like a whistleblower in China, who was like, something is happening here and everyone needs to pay attention because it's going to influence everyone, right? But the state tried to make him quiet, but thanks to social media, which again, technology, globalization, they couldn't keep quiet about it for long because everyone was like, something is really happening. You look at US, the president was like, it's not a big deal. But due to social media, because media houses before would tailor their conversation to just focus on what they want, but social media in its own way is framing conversations and making it seem like even if you try to agenda set, issues that are transboundary will rise to the top and policymakers will have to make decisions and choices at the top level. So in conclusion, I would just say that after this, I think there needs to be a change in how political and economic discussions are had. I don't know if developing countries will have a key role. I doubt it, because even as we deal with it, Africa is still dependent on World Health Organization, which is funded by states, and it's also still dependent on China. So I think it will still be a West versus East thing. It's just that we don't know who is going to have the upper hand. Probably China, because it's doing a really good job at this right now.
In the same line, just before in less than 30 seconds, yeah.
Yeah.
Now that you're in the US, and coronavirus is being regarded as a product of globalization. And we say that coronavirus does not recognize borders. Now, I want to ask you a very brief question, I think in less than 30 seconds. Would you comment on a possibility of an order whereby we don't have a globalization that is American centered, and instead to shift to globalization that is Chinese centered or East centered instead of West centered?
That's so. The thing is that even if we say US centered, we have to think of it as what do you call it, the global West, right? So yes, it's US which has always led, but it's also there are other developed countries that are also shape what happens at the global level. And we have to also remember that the US has an upcoming election. So this all depends on who becomes the next president. As
No.
we know, Democrats tend to lean towards, trying to moderate and be in charge of the international system, because that puts them at a better position, I guess, and it makes them shape their policy in a way that benefits them. Republicans tend to, as of, I don't know, the last elections, I think, I'm not well versed in US politics, but I would say that the current government is more state focused, which is what is happening in most of the rest of the world, where people are now discussing the rising populism and nationalism. So I think that's a whole other conversation, but I don't know. I think China has a hand in what it's doing, but we have to wait and see what happens.
All right, thank you very much, Helen. Juma, very quickly, I want to engage you on issues of globalism versus nationalism. What you have seen of late is countries are moving very quickly to be very state-centric, and they're focusing on closing their borders instead of opening their borders, and we have realized that is hurting the economy greatly. And I want to ask your opinion, especially in the area. Are we seeing a retreat from the wave of globalization, and are we now embracing a new wave of nationalism? Are we retreating from globalization to nationalism?
I think that the question of COVID-19 itself, first of all, just reminds us how interconnected we are as a world. That a disease from China is affecting somebody in Kenya today. This already is proof that the world is connected in ways that we never imagined maybe some years back. Therefore, also, with this realization, it's good to note that some challenges can be tackled from a state level. Kenya can tackle maybe a problem on its own, but some problems needs coordinated efforts. And especially a problem that's affecting countries, all the countries of the world, like COVID-19. So with this pandemic that's going on at the moment, country-specific approaches might not be very, very effective. We need more or less like a coordinated effort. A globally led approach is more far-sighted and I think more pragmatic in this case. So assuming that closing your borders and trying to prevent people from moving around will work, I don't think it will work very well. And I'm very optimistic and I believe that coronavirus will eventually be defeated. But for this to be done, I think that a more global leadership is required. In the absence of this leadership, I think that poor nations might suffer more, but only for some time. Then eventually, this thing will just turn around and go back to the rich nations.
Mr. Jim, on the same
Yes.
thought, yeah, I'm just concerned. You say that it needs a more focused global leadership. That you say
Yes.
the global leadership is missing. What do you think of China and the US? or even the European Union, all the G.
When I say that we need global leadership, I mean that every state in the they kind of came together to give the assurance that they'll do whatever it takes to end the pandemic. And of course, they promised to ensure that the lives are going to be protected, safeguards people's jobs, and help minimize disruptions in trade supplies. And above all, to enhance public health and financial measures. And if you look into these issues, they are very, very commendable. However, these measures from the rich and powerful nations should be taken with the consideration of poor nations like those of Africa in mind. I'll just say this, that while the numbers in Africa today might be looking like they are very low, and maybe the cases are not as much as Europe or America, to just point out, in the coming days, the waves might just change and Africa might just be in some dire situation because of the health systems that we have there. We know that in many African nations, the systems are quite weak. So in case these numbers rise there, we might be seeing another pandemic on the African continent. So as the world leaders converge because of the resources they have, because of the good policies they have, and they can be able to come in and provide coherent, robust, and coordinated resources to ensure that these health systems are well coordinated to ensure that in the event that the numbers continue rising as we're seeing in many African countries, they can be able to approach it. Failure to help Africa or abandoning Africa at this moment or any other poor nations will be catastrophic in the long run. Because the good thing with coronavirus is that it's not just for a specific country. It comes here today and tomorrow it will be somewhere else. When it began in 2019, many people are not even so much concerned about it. We are saying that these are Chinese problems. But come today in March, Italy is crying. So we cannot do the same mistakes again of avoiding to help people who are in need and to think that is their problem. We need a concerted effort to work on this. And this can only come from global leadership.
Thank you very much, Mr. Juma. Hold on to that thought. I think we'll be able to come back to it. Let me go straight to Rim. Rim, I want to pick your opinion on one of the issues that is quite disturbing, especially about African young people. Initially, there were reports that the virus does not affect the young generation as much as it affects the older generation and the people with the pre-existing conditions. Over time, I think that hypothesis has been falsified. And I want to understand what role can the African youth play in the fight against this virus.
Well, I think the unique thing about African youth, and maybe like the youth in the, in like not the US and Canada and places with like, in Britain with healthcare systems, is a lot of the youth, and especially here in Africa. So, I mean, we know now, and a lot of these, I think now, sexual information is going out with now a couple of young people around the world who've died from the virus. Like, no, okay, look, even if you don't have preconditioning, preconditions, even if you're not old, you'll get it, and there is a possibility for you to die. But I think one of the most worrying things for young people, which makes them, I think, even now part of that group of vulnerable populations, is a lot of them don't have access to healthcare. I think there was a case in the US where 20-something, I don't remember, 27, I think, year-old died more because she didn't have access to healthcare, right? So insurance that would have treated her. So the fact that young people, the reality of young people, we all talk about, COVID-19, it's, we're all in it together, but the reality is that we're all experiencing it differently. So even though we say like all African youth or all youth, right? We're all in different positions. I think the majority of us here on the call are in privileged positions where if we had to, we can work from home. We have some sort of job security, or, we're students. So being at home doesn't make that much of a difference. But the reality is there are people who are experiencing this in very different ways. And for the developing world, so for Africa, Latin America, and Asia, I think the major issue is how do we as young people address this? So don't get caught up in the, you know, the storm of social media or all these, you know, like US narratives of the virus, and, you know, being quarantined and, you know, quarantine day, this and that. But we really need to, and I think more so now, it has highlighted that we need to emphasize on equity. And as youth activists and youth movements, this is something that we need to now, you know, we need to, you know, like full force work on it. So instead of just what we were doing before, highlighting inequality and highlighting situations where there is no equity, talking and bringing attention, you know, governments to vulnerable populations, the lack of healthcare, job security. No, I think we had talked about, you know, how in these informal settlements you're talking about, okay, having hand sanitizer. They don't have access to hand sanitizer. They can't afford it, right? Here in Kenya, I think hand sanitizer is going for almost 1,000 shillings now, a bottle. And then, so you're like, okay, so wash your hands. In informal settlements, they don't have clean water, right? They don't have sanitation. And we've had now for years all these wash programs and things like this. But this is really a time for us to step back and be like, all right, so all these wash programs clearly have not had that much of an impact, right? So even in refugee camps, what can we now do differently? So us people who have the privilege to sit at home and probably have, you know, those networks with different organizations who usually do these sort of projects and things like that, and links to policymakers, is us to think really critically about the work we've been doing over the last couple of years and what we're going to do differently now, and how we're going to take equity seriously. And how do we bring people, you know, it's not now, it's more than just bringing people into the conversation, right? It's more than just dialogues and things like that, and conferences, which I think like loads of them have been, you know, cancelled, right? So also emphasis like, hey, you know, we really do not need these conversations. They could have happened online. How do we channel those resources into actually dealing with solving inequality and, you know, protecting people? How do we create systems? So the government here in Kenya, you know, released some sort of, you know, measures. So the president took an 80% paid cut, right?
But how beneficial is that? How many people can that?
Yeah, exactly, right. So, and they dedicated more towards the elderly and the vulnerable, a reduction in tax. So it's like, okay, you know, so you've done this, meaning we could have done it when everyone was saying this is what's needed. Channeling funds into now healthcare could have been done when we said this is what we needed. How do we now take advantage of this as young people into really pushing for these policy changes, and for us to also work on it as well? So as we sit at home as young people preparing for a post-COVID-19 world, are we taking care of the elderly? Are we taking care of ourselves, right? Are we taking care of the elderly?
And when you're talking of taking care of the elderly, I think you mean by us not exposing ourselves, then coming and transmitting the disease to the elderly.
Right, yeah, because I think there's a lot of young people, as young people, we feel like, oh, you know, we're bulletproof, yeah, we're young, and, you know, we're okay, we'll be okay. But it's really, you know, it is going to affect the elderly. And a lot of us, I think our generation, are in the situations where they are taking care of their parents. They are taking care of their grandparents now, right? So it's not, when we're talking about youth, you know, it's not, we're not just talking about 18-year-olds and things like that. We are talking about here in Africa, so youth, the bracket is higher, right? It's still 35. Yeah. A lot of us in our 30s are taking care of our parents, right? This is what we do in Africa. So it's that, but it's also being responsible with information. Yeah, so like not sharing inaccurate information, right? Not sharing, you know, and, you know, spreading fear, and things like that. It's just realistically dealing with this situation that we're in. I mean, in Africa, we dealt with Ebola.
Okay, now should we blame the young people for misinformation or sharing information that is not true, or should we blame the governments, which are either sometimes they are unwilling, unable, or maybe out of intention they don't want to share the right information? Because what happens if the right people are not sharing the right information? You open a room for people to speculate and share fake news. So I think that's a gap that the government has left, and that's why people are feeling it. and they're coming with these fear. They just following the fear that people have and making it look like it's so bad to have corona. But when you look at the data, you realize that many people have recovered compared to the people that have died. So if the situation is handled better, we can have more recoveries and death. Okay, fatalities are obviously, definitely they will be there, but we can focus on that, because in Singapore you find out of all the infections and all the recoveries, find only 2 deaths out of around over 50 recoveries. So it is very possible for healthcare is able to manage it. You find we can have more recoveries than deaths. What do you think?
Yeah, I think like this is like an issue that even goes beyond COVID-19 in terms of social media and how people share information and fake news. I mean, yes, the government does have a role to play in it, especially when it comes to like news media and things like that, where they do have control. But when it comes to like your community or your family WhatsApp group and stuff, right? As a young person who has access to information, you can call people out and be like, hey, no, this is not right. Yeah. Doing so and so, or whatever is not going to prevent you from getting it. Things like that. I think we're in a time where even our individual responsibilities as human beings is being highlighted. And so if we're sitting here and we're saying, the vulnerable populations in the informal settlements in Africa, like we have a lot of people saying it, once it hits the informal settlements, that is going to be disastrous, right? There's no self-isolation and quarantine and 1 foot away, and you don't have that luxury, hand sanitizer and washing hands, right? It's not there.
Yeah.
Much as we say we're going to wait for our governments need to do something, we're in crisis mode now, and we need to figure out and invent ways to reach out to those communities, to like get our hands dirty, even though we're talking about washing hands, right? But to actually do stuff to help.
Allow me to cut you short, but we'll be coming back to those issues. Let me engage our last panelist. Then we can have a rebuttal.
Sorry, Chris, just before you move on, I think there was one important touched on that I think was not emphasized enough, and that's in terms of disaster capitalism. I mean, there's news now for South Africa that there are some companies, for example, that use Facebook. They created groups and they started telling people about coronavirus through misinformation to sell their goods, and they made a lot of money through it. And it's not only in South Africa, also in the US. So, I mean, I think the whole thing of misinformation is important to note, because there are a lot of people who are profiting from misinformation, from selling hand sanitizer at extreme prices, from selling masks. And it's been happening from as early as December. These investigations are now saying there's been companies who've been doing it. So, and I mean, this is not the first time we're dealing with issues of misinformation, and people profiting from it. So, I mean, I just thought I should highlight that. Yeah, sorry, you were about to ask something.
Very welcome. Let me go straight to the question. And I want to quote a statement that was written in one of the papers. And I want to say that Africa countries are confronted by a public health emergency that is tempered with an economic crisis. Now, that's a question that speaks to issues of preparedness and ability to deal with the crisis. Do you think Africa is ready? Do you think Africa can be able to deal with this crisis in totality? Do you have the capacity?
Well, I mean, I guess the first thing we have to note is that I think in comparison to other places, Africa faces a unique set of circumstances. The first being poverty, extreme poverty. Within sub-Saharan Africa, the statistics are crazy in terms of the number of people who are living below the poverty line. We also have to think about things like HIV, especially in Southern Africa, where I'm based. That's a huge concern because a lot of people are already immunocompromised. So if that's the case, with this newfound challenge, it's likely to spread and cause a lot of havoc. So that's a widespread concern. Obviously, as already been mentioned, there's the issue of our weak healthcare systems. There was one person today, I was just scrolling through Twitter, and one person was tweeting about how in Burundi, they don't yet have any cases. And the speculation was that it's simply because they don't have any testing kits. I mean, I don't know the truth to that.
Well, I saw it. I thought
I don't know the truth to that. But yes, but I don't know the truth to that. But it tells you the extreme to which the situation we could be facing. You know what I mean?
Okay.
And also have to think about things like the informal.
Settlement. Okay.
In Kenya, for example, we're speaking about Kibera, the second largest slum in the world.
Mm-hmm.
In South Africa, we're talking about Soweto, and I mean, as soon as the virus is one of these, it's hard to see how it's going to be contained. There's no sanitation, there's no basic hygiene. You know what I mean? So, I think, to be honest, Africa faces a very big challenge.
Mm-hmm.
One which, in my opinion, I do not believe we are entirely prepared for.
Mm-hmm.
I mean, there's a shortage of ventilators. People are already speaking about that. If countries like the US are facing shortages in ventilators, people haven't even started asking those questions of our countries. Do we have enough ventilators? If there's a full-blown breakout, are we gonna have to start rationing the ventilators? There was a rumor from Italy a few days ago that people over 60 were no longer getting ventilators. Again, because of the age of misinformation, I can't know how accurate that is, but it tells you the extent to which this could get to. And you see now, the other things we have to talk about is obviously, you've spoken about things about equality as well. So for example, here in South Africa, Gini coefficient of about 0.68, one of the most unequal societies in the world. For example, if a minister catches the virus and someone in the slum catches the virus, the minister is definitely not going to one of these overcrowded hospitals.
So
you know what I mean? There's a report that
it's not a virus that puts the poor and the rich on the same level.
Simply because the resources, the way it's going to be dealt with, the rich are more likely to get the resources. No one is going to tell me that now that Boris Johnson has it, he's being rushed to an overcrowded hospital in the UK.
And he's
he's being treated at home. People, they're going to bring doctors to him in his household. He's going to get everything he needs in his household to ensure that he doesn't interact with everyone else. You know what I mean? And obviously,
is most likely to compare to a person in downtown.
Exactly. And also another issue in Africa, of course, is the issue of overcrowding. Even within urban centers, we have extreme overcrowding. So, to be honest, I think our governments have almost left it too late. As soon as we heard the first or second case had arrived in Africa, we should have started preparing, simply because our healthcare systems are a lot weaker than a lot of these other countries.
Okay, I want to cut you short. I want you to hold on that thought because now the last question.
Yes, come back to it.
I want us to discuss, and I think I want each one of us to take maybe 30 seconds to comment on these. Then we'll finish.
Yes.
So here's a question. Coronavirus has been compared to a war, and many countries. I want to ask this question with Africa. Is it an issue of indecisiveness? Is it an issue of incompetence? Where we are seeing many African states, they are not taking this issue very seriously. Yet they know if they don't come up with measures to prevent the spread, what will happen is the numbers will increase, the numbers of infections will increase. We are not able to test those numbers. We don't have enough kits to test the numbers. Our healthcare system will be overwhelmed. Number of deaths will increase. And what happens? After that happens, that's when we'll start instituting orders to force people to stay at home during the day. What will that be leaving us with? Because we have some money that we can spend at least to put people in the houses for 21 days or 14 days so that we can conduct a comprehensive testing. Then the ones that are sick, we can isolate them, quarantine them, and treat them. And at the same time, then we can transfer resources from internally from household level. We take them to the entry points, whereby anybody who's coming in is being screened, tested, then quarantine if they're sick, and in case they're not, they're quarantined for 14 days before they are released to go home, as it is happening in China. Is it an issue of indecisiveness when we see a country like Kenya and other countries in Africa who do not have capacity to deal with this issue, being unable to institute those kind of orders for a complete lockdown to prevent the spread of virus? We can start with Roy. That is second.
Okay, well, I mean, to be honest, so firstly, the first thing I'm going to say is that I do not think it is indecisiveness, or more of not taking it as seriously as it should be taken. And it's not just it's not just in Africa. In the US, we've seen that with Donald Trump. In the UK, we've seen that with Boris Johnson. He was in the news the other day talking about shaking hands, and now he has the coronavirus. You know what I mean? So it is 100% a situation of people not taking it as seriously as they should have from the onset. And I think, to be honest, we are faced with dire consequences, and I'm not entirely sure how we're going to deal with it at the moment. But I mean, the best we can do is keep optimistic and pray that our governments are getting their plans ready to deal with what is to come. As Italy and Spain has shown us, there's a lot to come.
Okay. Rem?
So I don't think it's indecisiveness. I think it's just the same problem that we've been having in Africa and as youth activists, which you've been asking for. A complete lockdown is not going to work in Africa if governments and NGOs or whatever do not address the fact that if you're telling me to stay at home, that means I'm not going to eat for that day, and my family is not going to eat for that day, right? So for me, if we were going to borrow the model that everyone has been doing, ask for a complete lockdown so we can do testing and things like that, then the government has to be as extreme and work right now in providing sanitation, in making sure that if you want to get people to stay at home for a day or 2 days, every single household in these informal settlements have food. That's the only way it's going to work. And for me, I think that is what's not being taken seriously. That in Africa, we are in a very different economic situation than we are in some of these other countries. So if lockdown is going to work, this is the only way it's going to work.
Juma?
I don't think it's lack of decisiveness in my opinion. I think first of all is appreciating the realities that we have on the ground. Looking at countries like Kenya, for instance, you can't ask the Kenyan government to feed its citizens maybe for the next 2 or 3 weeks. It's simply impossible. So I think also the people in Africa and the Kenyan government particularly needs to be more creative and try to look for homegrown solutions. I know that these things have been working in Europe and probably the other countries like China. They closed down Wuhan, and Wuhan was able to come out well, but people are getting food in Wuhan. If you look at the Kenyan context, I think we need to address the problem also looking at the context that we are in as a state. For example, Kenya, you can't simply tell the people of Kibera to stay in their houses, not give them food, not give them water, and want them to be on lockdown. In either way, they will die. So they have to survive.
Are you getting food in your house in Italy?
In Italy, no. They don't give you food in the house. What happens is that the government allows you to go to the supermarket to go and buy. But again, if you look at the rates of unemployment in Kenya and Italy, you can't compare. People here, the kind of are richer compared to the people in Kenya. So for this reason, you cannot use Italian solutions
for Kenya
to solve Kenyan problems.
Makes sense.
Yes, the government must think, and this is the moment. This is the moment where leadership is required. African governments and African leaders must come up and show leadership. Try to provide tailor-made solutions for the problems of the continent and not just copy-paste things from Europe or from anywhere. But let's try to get solutions now and deal with these things as Africans first. Of course, learning from other people is very good, but learn from them and try to tailor-make it, also being cognizant of the challenges we face as a people.
Okay.
I'm sorry, Chris. Just before you finish, I remember there's one important point that I think is also unique to Africa, And I think that is going back, it's linked to disaster capitalism, but it's opportunism by our government. So, for example, in Kenya, people have to ask, why is the lockdown only for such a number of hours?